It's Thursday at 4 o'clock, and welcome to another episode of AirSculpt TV. Today we're going to talk with our patient who actually had regular liposuction 2 times before on her tummy, and on this show we fixed it, and her picture's right there, and we're going to post all this. But it's a great example of a lot of people have had body contouring from other doctors, other types of technology, other procedures. They're not happy, and then their journey afterwards and how AirSculpt can help them. She's so happy that we're going to go to Seattle with Dr. Bullis, and she's now having her inner thighs done. So we're going to watch a little bit of that, and we'll have a chance to interview her. If anyone has any questions for her, please write them in. But we've gotten some questions already, and we're looking forward to talking to her about her experience. So without further ado, let's go to Seattle.
Hi, we're here in Seattle with our lovely patient Karen. She
Thank
is
you.
currently getting her inner thighs and her banana rose air sculpted.
Mm-hmm.
So we're gonna go take a peek inside and see how she's doing.
Thanks so much.
Hi, Karen. How are you doing? I'm well. You're live on Instagram Live, Air Sculpt time.
Hi, Dr. Rollins.
Oh wait, I can't see Karen. Hi, Dr. Bullis. Oh, unfortunately, the signal is weak in there. Okay. Hi, Karen.
Hi.
Thank you so much for doing this with us, not once, but twice now. So,
Oh, yes, I know. Happy to be here.
I'm looking at your before and after pictures from your previous AirSculpt. Now, you had regular liposuction 2 times before.
Yeah.
And guys, that's the black and white picture behind me. That's her befores. And then this picture that I'm pointing out with my thumb is her right before AirSculpt. I love your result after AirSculpt. So what I want to ask you for our audience here is, since you've had liposuction twice, then you had AirSculpt, tell us the difference. Obviously, the result is a million times better. I mean, what do you think about your result?
Oh, the results are absolutely amazing. It's so much better. I mean, my waist looks snatched. I feel better. And I'm awake during this procedure, which is absolutely great. I can see everything that Dr. Bullis is doing.
Hmm?
And the fat's coming out, and I just love it because I think the results are absolutely 100% superior than previous.
And what about the downtime and the swelling and everything you went through after lipo compared to this?
Well, after the traditional lipo, it was 6 to 12 weeks recovery with AirSculpt. Oh, and it was also painful previously. With AirSculpt, it was just 2 weeks. I was back to working out in like 3 weeks. I was back to playing tennis, and then even played in a tennis tournament. I think I played in 2 tournaments.
That.
It was
Okay.
my last procedure.
And wait, and when could you or when did you go start working again after your procedure?
Oh, just the next day.
Perfect.
Yeah.
So that's amazing news. And I imagine after liposuction, you wouldn't have went to work the next day.
No, I think I took several weeks off, took some vacation time.
Yeah.
But no, I don't need to take any time off. I mean, I'm gonna, like, after this one, I will relax tomorrow, but I'll do, start working again the following week.
Vacation time is for vacationing and not for recovering from surgery.
Yeah.
You know what I'm saying? Yeah.
Yeah.
Use that vacation time wisely, guys. So you're decided to have your inner thighs done. Have you had them done before?
No.
Oh,
No,
that's great. So what you're going to notice, Karen, is that what you had before on your stomach, it's as hard as AirSculpt gets. Your inner thighs are going to be way easy, heal much faster, be much less swollen, much less painful. When you have scar tissue from previous liposuction, it actually makes AirSculpt harder, more difficult to heal, and it limits what we can do. even though we achieved something, Dr. Bullis knocked it out of the park here. I mean, Dr. Bullis, you did a wonderful, wonderful job. Like, I mean, it's just spectacular. But your inner thighs are going to be even easier. So you're going to actually have a better experience this time.
Oh,
So,
good. Yeah. So far, it's great.
so you're having your inner thigh air sculpted right now. How much does it hurt?
Oh, it doesn't hurt at all. It just kind of tickles a little bit.
Can,
It's just like coming to the spa.
I love that. Can we see what's going on? Can you pan over to what's going on with the air sculpt so people can see?
Yeah, so she's getting her whole inner thigh and knee done. So we're kind of doing this whole inside. We've
And
already
it
got
looks
rid
so
of that
smooth. I love it. So let's just watch Dr. Bullis go. Dr. Bullis, any commentary?
Pardon?
Any
Yeah,
commentary?
so we've done the left leg already. The right leg is maybe about half done. How much do we have?
Okay.
Yeah, so about half done. I'm going to get a little bit more. I'm going to have her, let's have you straighten out your leg. I always like to look at how this fold, this is what everyone hates right here. Get rid
Right.
of it.
I call that the crotch pocket. Yeah.
Yeah, so we're going to get rid of that. And I like to do that with the legs straight, really.
Yeah, me too. Perfect. And everyone, this is all going on in Bellevue, Washington. It's in Seattle. So
Go Hawks.
in Seattle, and they're all laughing in Seattle. So, and let's take a look at the fat. Can we pan to the fat? I want to see how much. Oh my goodness, Karen. Karen, you're bringing the goods. Wow. And I want everyone to notice. Wait, go back to the fat. How much blood is in that fat?
It's like
How much blood?
maybe.
Not even 50%.
Hardly anything. That's
That's
mostly
pure
just water.
cheese. I love it. It's amazing. So that is like, I mean, and that's why AirSculpt is by far the best technology that exists. Like, no one else can do this. So that is incredible, just beautiful. And you can see there's no blood in the tube or anything. So, and that means less bruising in general. That means quicker healing. It means we're not hurting her and her underlying structures. We're literally just taking out fat. So pretty cool. So Dr. Bullis, how much did you get out of her first leg?
I think just about 200 cc's. So, you know, not a tremendous amount, but I think it's going to keep her with a really nice natural taper. I see some people get overdone, and then it looks like they have elephant legs. And
Yeah, for everyone, I totally agree with that. For everyone watching, inner thighs are probably the hardest area to body contour because if you do too much, you actually can ruin them very, very easily. So it's a tightrope walk to do perfect inner thighs. The skin is very thin, and you need to leave a little bit of fat so that the legs look natural and smooth and normal, and they're not lumpy, bumpy. So it's actually the hardest area that I train our surgeons to do, and it's the hardest area to do in body contouring, period. So, Karen, obviously, you're in excellent hands. So, and what kind of music are you listening to? I ask everyone.
Oh, Billie Eilish.
Okay, I like her. Nice.
Yeah.
I like that. What's your favorite Billie Eilish song?
Oh, what's that? Oh, I forgot the name. It's like One Life. You know the one
yeah,
Life?
we just heard it.
Yeah, we just heard it.
Okay. I like the one that's like Bad Man or Bad Boy or something.
Oh, yeah.
Bad
that's
Guy.
it. Yeah,
You
I
like that one too?
Yeah.
Yeah. So that's all we have for you. What do you want to tell our Instagram audience here, based on you've had 2 previous lipos, then you had AirSculpt. You're having AirSculpt of your inner thighs now. For people that are thinking about having this done, what advice would you give them now that you've been through it all?
I would say absolutely do it. I mean, particularly like a person, ethnic person or person of color like myself, African American, we actually naturally carry extra weight in our hip size and buttocks. And all the diet and the exercise is not going to get rid of the stubborn fat areas.
Mm-hmm.
And I want to tell the audience, you don't need to just spend the hours in the gym anymore. Just stop doing that. It's not going to come out. Just make a consultation with AirSculpt and have AirSculpt solve your problem.
Thank you. I love that. And then what about to the question that we get asked all the time, is AirSculpt anything like liposuction?
No, it's nothing like liposuction. With liposuction, I'd either be under a light anesthesia or general anesthesia, and I'm awake now. There's no needles, no scalpels, no stitches. I
Exactly.
can talk to Dr. Bullis and the staff here the
Thank
entire
you.
time, and I can watch the fat come out.
And how do AirSculpt results compare to liposuction results?
Oh, they're absolutely 110% better
Thank you.
than the
That's
traditional.
what that's what we work hard to let people interested in AirSculpt understand. So I really appreciate that coming from you as one of our return patients. So we really appreciate that, Karen. Thank you. So, all right. Well, we'll let you guys do your thing here and go back to our regular programming. Thanks so much, Dr. Bullis and the whole
Thank you.
Seattle office.
My pleasure.
Bye bye.
Bye from
Thank you, Karen. Let's put up, we're going to show her picture in a little more detail now, and we're going to post it. But I want everyone to see. So what's going on here is this is called revision surgery. And what we're doing is she had, I'm sure she had a great doctor who did liposuction on her tummy. And not only did it once, but did it twice. But please understand that you could have the best race car driver, but if you're driving a bad car, you're never going to win the race. We have the best car. And the technology means that you can do a better job than you could ever do with any other body contouring technique. As you can see here, she had it once, and then she got to this. Then we went here. This is how she came in. And you guys can, expand her picture on Instagram and everything. I really want you to take a look at this result because it's a totally different ballgame. And that's what, it's so hard to explain to all of our patients that are interested and everyone asking for information. And that's why we're here is this is nothing like liposuction. And it's a dirty word to me. I would not send my worst enemy to get liposuction. So I think, as she said, AirSculpt she was back to work the next day instead of using all of her vacation time and waiting weeks to go back to work. She was playing tennis in 3 weeks. And frankly, when you've already had liposuction, you have tons of scar tissue. And that's a lot harder to heal. Yet she still followed the same pathway as all our other patients, back to work the next day, back to the gym in 2 weeks, playing tennis in 3 weeks, etc. It's really important to me. I mean, this is just a fabulous result. It's so much harder to get a good result when someone's had liposuction once, let alone twice. So I'm just really proud of the Seattle office, Karen and Dr. Bullis, and I appreciate you all watching. Now, a couple things to say. We had a bunch of questions. I'm going to answer some of them. And here you go. One of the questions is, will I be able to walk after this procedure? Thanks for asking that because you have to walk after this procedure. In fact, we insist that every patient walks 45 minutes a day starting the day after their AirSculpt procedure. It helps encourage healing and prevent problems down the road and makes you heal faster, actually. And then how long does this procedure take? So she's having inner thigh, knee, and banana roll. What's banana roll? Banana roll gives you more of a contoured look. It's basically doing the back of your inner thigh. And it creates a little bit of a thigh gap. It makes your legs not touch or rub. And I think that's extremely important. This whole procedure should take about an hour and 15 minutes to an hour and a half. When can I resume running? I would say between 2 and 3 weeks. Can thigh AirSculpt be combined with fat transfer to make my hips wider? And the answer is absolutely. Inner thigh fat is actually my favorite fat to transfer. It takes very well. It's an excellent, it's soft fat. It survives very well. So I encourage you, if you're having inner thigh AirSculpt, to consider having a fat transfer. If there's an area like if you want a hip flip, if you want an uppercut, if you want a Brazilian, it's a great opportunity to harvest fat for that. Can I wear tight clothing after this procedure? Well, in fact, we give you tight clothing to wear. We give you special Spanx so you can wear tight clothing, yes. which you have to wear the special Spanx we give you for 2 weeks. And can I still have my thighs done if I have excess skin? That's a wonderful question. With AirSculpt, your skin will always be tighter than what you started with. Will your skin be tight? It depends on what you started with. If you start with really loose skin, your skin is not going to get shrink wrapped. It's impossible. But your skin will not be looser, it will be tighter. And tighter is what's really important to us, is we always want to make your skin tighter. We want your skin to fit your new shape. Will my cellulite be treated or affected? The answer is no. It will not be affected. It will not be treated. I personally feel there's no effective treatment for cellulite. Some of our patients say their cellulite got better from AirSculpt, but it's certainly nothing I'm promoting. If it gets better, that's wonderful, and I'm super happy. But I wish there was a good treatment for cellulite because we would offer it. But I don't want to offer anything at Elite that doesn't really, really work dramatically well. Because this is your hard-earned money. This is your life. You only have one body. Do the right thing. That's my motto, is you do it right the first time. Can I target my hips and thighs at the same time to give me an hourglass shape? Absolutely, I encourage that. She has an hourglass shape, as you can see here, and she wants to complete that look. This is going to make her butt look better. It's going to give her that thigh gap. She already has the snatched waist. I'm thrilled with how she looks now, but she's going to look even better in a few weeks. And of course, we'll keep you updated. We love showing our patients, 48 hours after, 3 weeks after, and we're going to continue to do that. So we'll post this. How many weeks is she, Lauren, here?
This was actually 3 months post-op.
So she's fully healed in this picture right here. So that's her before AirSculpt, but after 2 previous lipos, and this is after 3 months after AirSculpt, and the proof is in the pudding, as they say. So please take a look and enjoy. Thank you very much for watching.